We are live. We are recording. We are ready for lift off. Hello and welcome to Let's Figure It Out, the live show where I interview my favorite people on what they do best, the health, mindset, and behaviors of women that want more for themselves and their family and are willing to ask the hard questions to figure it the heck out. So my name is Dr. Keela Rosner. I'm a naturopathic doctor in Stratford, Ontario, and a wellness cheerleader, and I love helping busy, stressed out women to optimize their hormones, their crappy digestive systems, and their sleep so they can carry on with what they do best, really kicking ass at work and enjoying their personal life even more. And before we get started and I introduce my guest for today, I want to let you all know that this series is brought to you by my new course where I take you from feeling fine to freaking fabulous by sharing with you the critical strategies that I use with my patients and with my own family to optimize our health so that you can stop feeling fatigued, bloated, and hormonal in under 10 minutes a day. So today I am joined by Dr. Jen Hardie. Dr. Jen is one of the lovely naturopathic doctors that I entrusted my first baby to, my naturopathic practice, while I was off having my first other baby. So Dr. Jen, welcome. I just love working with Jen because you do such a great job helping people get down to the practical basics of why we might not be feeling our best. In particular, I love that you have such a strong focus on overcoming anxiety and fatigue and metabolic issues like polycystic ovarian syndrome and IBS and blood sugar things and just chronically feeling crappy and getting people the heck out of that. And it is my absolute joy and pleasure to welcome you to Let's Figure It Out. Hello.
Thank you, Keela. It's awesome to be here. So happy you're doing this for everyone to kind of get some knowledge out and get people feeling better. It's great.
That's the whole point. We are all at home being forced very clearly to look at what is working for us, what's not working, what our limitations are. And I think it's just such a rare opportunity that we all have right now to look at and think what is working for me right now, what's not. And that sometimes that realization is really quite uncomfortable. You've been hearing with all of our clients recently. So my goal with these talks is to really have some open and honest dialogue about what we're all feeling, and then not wallow in it, but move beyond that with some clarity, with some practical knowledge. And for those of you that are joining us live on Zoom or over on Facebook, welcome. I just want to let you know that there is a chat box and a Q&A here in Zoom, and I'm more than happy to take live questions, as is Dr. Jen. And if you're catching us on Facebook or on the replay, we are thrilled to take your questions as well. Drop us a heart, say hello, let us know that you are watching. This is so much more entertaining if you do. So what I wanted out of our session today, Jen, and why I picked you in particular for this week is the feedback I've been hearing over and over with some of our clients virtually with their naturopathic practice is that I am so tired. I keep wandering over to the fridge and foraging for things that I don't actually need. I'm having trouble getting up and moving and staying motivated, or I'm staying up at all weird hours. And I've been hearing this over and over. So what do we do when we're fatigued? How can we start to build energy? And this is why I really wanted to bring you on, because you've really developed some practical strategies in your clinical practice. And personally, I know we've both come through a really challenging medical school program that literally kicked both of our butts. And you and I have both dealt with some pretty persistent fatigue coming out of the naturopathic college, right?
Yeah, it's definitely taken a toll on us, and we're feeling a little bit different having this space and opportunity to kind of get back to we have all these tools, and now we're able to implement them and not be stressed in school. So it's kind of nice in that sense. So talking about just some of the easy things that we can implement daily, especially in the situation that we're currently in, is just trying to find a good routine and stick to it. So that's where we're losing energy, is that we're bored in a sense if we're not being productive, we're not making goals, we're not setting ourselves accountable for things. And that's when we find that we just stand in front of the fridge and look at it, and you almost need to check in with yourself and say, like, oh, am I hungry? Am I getting hunger signals right now? Or am I just opening up the fridge because I don't know what to do?
And why is it that wandering over to the fridge like a zombie seems to be like the default for most people? Do you have any idea?
I mean, I've been finding myself do it, and I'm very quick to figure out, how am I feeling right now? Like, so if boredom is coming up, is there something else that I can do that's more productive? Because sometimes, yeah, it's almost like our brain creates something. We're feeling bored. Instead of sitting here, we need to get up and do something. So let's go to the fridge. And we usually end up grabbing something that's quick and maybe not healthiest. So checking in with how you're feeling and then working through that. So if it is boredom, if it is stress, then working through that and figuring out, can I be doing something more productive? Do I need to go outside into nature, take a walk? What can I do to kind of shift my energy instead of going to the fridge?
Okay, so let's talk about building a routine. So from my perspective, I have fought so hard against building a routine. To me, that always sounded like, something an old person would say. I've got to stick to my routine, and this is when I have my bowel movement. And it just sounded so mind-numbingly dull for me. But I also recognize that that is personally one of the best things that I can do, so that my body knows what to expect. I mentally know what to expect, and to set expectations for, this is when I'm working versus, and this is playtime, versus like always kind of feeling like you need to be doing something and always kind of feel guilty when you're not, but then doing a really half-assed job when you're attempting to do work. So can you talk to us about what building an efficient health supportive routine might look like in a day?
Yeah, so if we look back on, like, our natural body works in our circadian rhythm, right? And that's what our body is like expecting, that we wake up, our cortisol is a little bit higher, it goes down, our melatonin goes up at night. And when we're in that routine, then we can create more energy for ourselves. And sometimes it's sticking to those routines of get up at the same time every day. This is what I do, like, that your body, like you said, like, knows what to expect. So for me, like, if I'm getting up and have a shower, I'll do like the contrast showers just to kind of get blood moving, lymph moving, get your body working, and then you go about your day. And instead of, yes, doing tasks and then switching back and forth, it's like, sit down, do the task, and then have your time to kind of go outside and do something where you can find joy. Because if we're stuck in this like in between stage and we're not fully happy doing what we're doing, then we're going to lose that joy, and joy can bring us a lot of energy as well.
And the absence of it can make us feel a lot more fatigued.
Yeah,
I
exactly.
love that. That makes so much sense. Helping your body to know what to predict. And one thing that I know you and I often talk about with on the backside is building a bedtime routine, so that in the morning you're waking yourself up. I often call that our morning marathon, where it's just like, maybe you do 3 things that help to build energy, something for your mental well-being, something physically, whether that's stretching or having some hot lemon water, we often talk about, and then something kind of forward thinking, like, what do I want out of my day? What's the next step for me personally or spiritually or whatever. But then on the back end of that, having a bedtime routine to help like wind down the day. And I was just saying to a client last night on a consultation that in these weird times of stress right now, it's not uncommon to feel even more fatigued, because our body's kind of like in the state of like, I don't know when this other shoe is going to drop. So I often use the analogy of taking care of a toddler. Right now, I've got a 4-month-old, so it's a little bit different, and bedtime routine's a moving target. But you would never expect a toddler to be hopped up on sugar all day, not have any structure, be traveling, like being up and down and eating at irregular times, and then expect them to go to bed like a perfect little angel, and then be cheerful the next morning if you're disrupting them all the time. So it's almost like during these weird times, we need to parent ourselves and be that bigger parent to ourselves and care for us like we're stressed out little toddlers.
Yeah, exactly. And that's part of like kind of what I've been digging into is the whole aspect of reparenting, because we do become adults and we realize that I can do things on my own terms, but that's where we end up falling off and not having the healthiest lifestyles because we've been not reparenting ourselves. We almost need that. We need that structure.
So tell me a little bit more about reparenting yourself from a health perspective.
So like we were talking about, just having like appropriate boundaries that will help you to know, okay, this is what I want to do, or this is what I expect for myself. And then that can create less stress in our life. And that'll affect everything else, like our hormones that we get into. You know, we want to be working on making sure we're having appropriate boundaries, or else we're going to be pulled all in different directions. So it all ties back into how we're feeling.
Like a little kid that's just spinning out all the time because they have no expectations for how to behave or how to act. And
Exactly. Yeah.
okay, yeah, and that's inherently really stressful on our physiology.
Yeah, exactly. And it just takes slowly, we won't notice a huge shift right away, but over time, that's what's going to take a toll on us.
So you mentioned, I love that. You mentioned earlier contrast showers. This is something that I love, hate to do, love to have done.
Yeah.
Tell us a little bit, first off, about how you do that and why you would ever want to consider doing that in the first place.
I feel like now is the best time that you can start doing it. It's like when it's kind of getting warmer outside. If you tell someone in the middle of winter to start doing it, they're not as happy. But it's just pretty much trying to get the biggest contrast that your body can handle, because it allows your body to be better to adapt to external stressors or creating more energy in your body. So we do that by 30 seconds of cold, and then you alternate it back to as hot. And you want to do this in at least 3 cycles to kind of get the blood and the lymph moving through the body to kind of wake you up, get you feeling good.
Amazing.
Yeah.
So would you do this like as a separate standalone thing, or do you do this like if you're already having a shower or a bath and then you're like, hey, I just want to up my health parenting right now?
I do it when I'm already in the shower, and then do it towards the end. And you're supposed to end with cold, which isn't the nicest, but just adding that into the routine.
Okay, so like your legs are shaved, hair's washed, like everything's done, you're about ready to get out, and then you do it.
Yeah, just do some alternating back and forth and then get out. You could do it throughout the whole shower if you like, but
that's a little distracting. Like
yeah.
I picture like so many razor burn cuts because you're like, oh.
Yeah.
I love it. I personally do contrast showers at the first sign of a cough or a cold because it helps to increase circulation throughout your body. More circulation means more white blood cells working and driving around your body to help fight whatever infection. And I've also discovered that it is fantastic for pain relief. If like you've had a long day working in the garden, hang on, we are going to be doing a gardening segment in another upcoming episode. I'm just planning that right now. But if you're getting out there pulling weeds and your low back is hurting, or you like have crappy posture because you're sitting at a desk far longer than you should because you've got crappy work-life boundaries right now, aiming that shower head at whatever hurts works really, really quite well and is affordable to just about everybody, especially if we can't get out and see our chiropractors, our osteopaths, and our massage therapists right now.
Yeah, the things that we can just do and change in our daily lifestyle makes such a difference overall.
All right, so the contrast showers, what else do you personally do you find to help recover from that chronic fatigue that many of us have from being in Stratford, working a festival season, or being a student, like that pervasive, it's not just a weekend where you don't get sleep, but that chronic fatigue?
Yeah. So then in that aspect is like really checking in with what foods you're eating, and are you listening to your body of like, are you having the best quality of foods? Like good quality protein, good quality fats, and then checking in with how much fiber you're getting each day. A lot of people will reach for the snacks that don't have the best fiber to carbohydrate ratio. So even that little tool, where you're just checking on the label and seeing, okay, what's the carbohydrates, and then divide that by the fiber. And you want that number to be less than 5. And then that can say to your body that you're going to feel a little bit fuller for longer, and you're not having that quick spike in insulin that's going to make you feel fatigued after. So when we are chronically fatigued, where we're just dragging ourselves, that's usually when our body is going to try to seek out the higher carbohydrate, higher glycemic foods, which won't make us feel better.
Right. It's like a quick and dirty version of that hit of energy. So this was new to me.
Yeah,
So you want
exactly.
the ratio of total carbohydrates divided by fiber to be over 5, and that's telling you that you've got lots of fiber and you're going to feel more full and satisfied?
Under 5, yeah.
Okay. Yeah, my
Yeah, so
fractional brain.
carbohydrates divided by fiber. Yeah. Yeah, because you don't want a ton of carbohydrates and then no fiber in there, because then that's just going to spike up your blood sugar.
Gotcha. So
Yeah.
give me some example of foods that might be a little bit higher in fiber that are exciting. Because when I used to think of fiber, I used to picture my grandparents stirring their Metamucil, and that just sounded so not appealing. Tell us about some more exciting options.
Yeah, so that's just mostly vegetables that we can get in. But then like chia seeds, hemp seeds, ground flaxseed, those are the things that we can easily add into things. So if you're having oatmeal and you want more fiber in it, if you're having a smoothie and you're wanting to up level that by having more fiber, those are easy things that we can add in, on top of looking at each of the packaging. Because yeah, packaging is a big thing that people get confused of.
Right. When at the end of the day, most of the food that we want to be eating doesn't necessarily have a package.
Yeah, exactly.
And
Yeah,
do you
we
ever
want to
get
be having real foods.
sorry, not to interrupt. Do you ever get people to track how much fiber they're taking or using?
I mean, it's beneficial if they can, if they're doing any sort of tracking food, just because most of us aren't even really aware of how much we have per day.
Oh,
Um,
totally.
yeah, so being more aware of that can definitely help with everything: blood sugar, energy, bowel movements, all those things that we want.
That make us much happier human beings.
Exactly, exactly.
Um, can you give us like maybe a day in your life? Like what kind of foods do you eat if you know that you've got a full day ahead of you and you know you need to like really put the energy into the tank so that you can function and thrive?
Yeah, so for me, I try to start my day with having a good breakfast that's higher in proteins. So I'll have like eggs, usually 2 eggs, on a small piece of toast with avocado, hummus, and then I have berries with it. Um, or I'll have a smoothie that's higher in fiber, berries, and then avocados and everything else in there. If I'm going longer throughout the day, I just want to make sure I always have snacks that are high in protein, high in fat. So I usually carry around nuts, or having pre-chopped up vegetables with hummus is easy to snack on.
Awesome. No, that's really quite helpful. What about for people that are doing intermittent fasting? Because I know that can be really quite helpful for some people for resetting their blood sugar balance so that they're not super hungry all the time and so that they are losing weight and reducing their metabolic risk for cancer, diabetes, polycystic ovarian syndrome, brain fog, pain, inflammation, dysfunction. Um, does that change? Do you recommend that they eat breakfast right away and then eat earlier in the day? Do you recommend eating later?
I mean, there's multiple different ways of doing intermittent fasting. So it's all about shortening that window, right? So you have a feeding window. It's not about reducing the amount of food that you're eating in the day necessarily. You still want to be eating enough food within that window to make sure that you're feeling full. So we don't want to fully calorie restrict. We do want to just make sure and everybody can do it different. Some people like to wait until 11 a.m. and then they can do that, or some people like to eat first thing in the morning, and then as soon as that 6 p.m. hits, they're done for the evening.
Right, kitchen's closed.
Yeah.
And what does that do for our body, having a break from eating during the day, provided that you're actually eating good food when you're eating?
Yeah, so it helps to kind of reset our gut. A lot of what's happening is that we're eating little bits, which is causing our migrating motor complex in our gut to always kind of be working instead of allowing that reset and having that time to kind of allow the cells to kill off the bad things and have all that autophagia going on. And that can just help with everything, like our immune system, our blood sugar, like it just kind of resets our body, and instead of having little bits of food throughout the day, because that can just cause inflammation that we don't want.
I like to think of the migrating motor complex, and honestly, this is not something that I'd heard about until after I'd graduated. It's kind of a newer concept, as like the janitor in your digestive system, or the night janitor. It can't really come in and do its job of moving through things through your gut until everybody's out of the office building. And if we're always kind of sort of eating something, it's kind of snacking and grazing all day, the night janitor can't come in and do a good deep clean, and then we're more likely to get backlogged and feel bloated and maybe develop digestive conditions and get a lot more IBS or inflammation, perhaps. Does that make sense?
Yeah, absolutely. That's good analogy. You're always good with those analogies.
You know, I'm a talker, so we
Yeah.
gotta let the night janitor do the work, and that, I think, what you're getting at, that's the real advantage of having a kitchen's closed, no food passed here at a certain time of day,
Yeah.
and that certainly can be helpful for blood sugar. You also mentioned, I know you're a big fan of working with apps and technology to support your energy state as well. Can you tell us a little bit about what you love, what works for you?
Well, I usually use like Insight Timer as more of the meditations to help calm us down, because the stress that we're experiencing day to day and we're just chronically building up, if we're not checking in and working with that, we're going to eventually feel fatigued. So I use Insight Timer, or the other one is the Calm app as well.
And when's a good time to use these apps if someone's feeling tired and not necessarily thinking they need to wind down because they're always tired?
Yeah, like you could use it throughout the day. Like if you just want to have a quick 5 minute listen to a meditation, kind of check in with your body, deep breathing. Sometimes we're not even breathing properly, which can affect how much oxygen we're getting to our cells, and then that's going to affect our energy. So taking that moment to kind of reset our body can help to reestablish our stress and lower it down and make us feel a little bit more energized.
Perfect. So, yeah, so what you're saying is, like, if somebody is feeling kind of fatigued and blah, it's also important, even though they're tired, to consciously check and come down so that their body is calm enough that they can sleep or can think creatively or can come up with a solution to a problem. Because I feel like a lot of people right now, they're just in the state of analysis paralysis. They're like, what should I do? Should I join this course? Should I become a different person? Should I like
Yeah.
go do this other workout? And we just get so paralyzed with all these options and things that we think we should be doing that we end up doing none of it. Meanwhile, our body is feeling that anxiety. And I think in many ways it's protective. If we're like feeling up here, our body's almost like, calm the heck down. We're going to
Mhm.
make you feel tired so that you have to figure it out.
Yeah. Yeah, absolutely. That moment of freezing just kind of shuts everything down. It's like I can't handle this, so I'm shutting down, and I'm too exhausted. But then it's like if we can get back into that parasympathetic side and just like that creative side of us, if it's painting, going outside and being in the garden, like whatever it is, listening to a meditation where you can get back into that intuitive side of you, then you can rebuild yourself back up.
And why do we want our body to be in a parasympathetic state? What else does it do for us?
it helps with rest and digestion. And with that, it's going to help everything else in your body. If we're digesting things properly, we're getting the food, we're getting the nutrients, we're getting all those good cofactors to help build healthy hormones, all the things.
Yeah, because if our body's like always go, go, go all the time, like digesting and extracting even the best quality meal is not a priority. It's just slamming the nutrients and carry on. And one of the other things that's not going to be happening is you're not going to be having a really great libido because your body's sensing danger, danger all the time.
Yeah.
So suddenly winding down in a way that's probably going to relieve a lot more stress is not on the table for your body. So I love that you're using apps like that because they can quantify like how effectively your body is getting into that state. And sometimes it's really helpful just to have somebody tell you what to do.
Exactly.
In a calm way.
Yeah.
What other strategies do you use in particular when you're feeling kind of bogged down and just blah, to get out of that funk?
I personally will find something that I find my creativity in. So I've been painting a lot, or like finding something like hanging out with your animals to kind of bring you joy and get you back out of there.
So, what if somebody doesn't really have a creative practice like painting at this point?
I mean, I think I'm not sure. Whatever you find creativity, and we all have to have that where it can kind of make us feel being out in nature. Not sure what else.
I think from a creativity standpoint too, it's really easy to get into this state where it's like, if it's not good enough to sell, it's not worth my time. But there's so much research right now looking at art therapy for reducing anxiety, for example, and for getting into that theta brainwave state where we're a lot more receptive to things, we're calm, we're collected, we're creative. And now's a great time, as you mentioned, to be outside and to really notice the world around us. Do you have any practices that you do while you are outside going for a walk to remain focused, or what do your outdoor adventures look like?
I mean, I'm usually with my dog, so we're finding adventures and places to go. But I also will listen to podcasts, kind of whatever I'm feeling that day. Listen to that, and then other times it's just simply being more aware of what's around, listening to different sounds that are outside that's bringing you back to the present moment.
So instead of just always numbing it with more input, you're tuning into what's outside around you too.
Yeah, the mindfulness aspect is important.
I love it. That's fantastic. So what if somebody has a bit of a morning routine? They have some structure into the day with what they're doing with reasonable limits, and they're eating the fiber. They are eating regular-ish meals, but not all damn day. And they are still feeling tired. Is there something as a clinician and naturopathic doctor that you would be looking at in terms of investigation or testing to see what's normal, what's not?
Yeah, so if that's the case, then I mean, it's going to be important to check in with your healthcare provider, make sure you have like a routine blood work done, checking, like seeing your thyroid, your iron levels, all of those things that we want to be monitoring, and just maybe there's something deeper going on that you do need more targeted approach with.
So in that case, if you're mentioning thyroid, iron, vitamin B12, basic blood work, what kind of things are we looking for? Are we looking for just everything to be in the normal range? I mean, I feel like a lot of people get that from their family doctors. Are you looking for something different?
Yeah, so we technically would want to be looking at optimal ranges. So we see that, take for an example, like your ferritin level, which is your storage of your iron, the range is so broad. So we have a general optimal range where we like to see females sitting at, and if they're a little bit below, they could be still within the normal range, but they're still not feeling their best. So that's where we want to be making sure we're optimizing it all.
So those would be considered some of the basics, right? Like make sure that we've got good nutrient status, which of course goes back to how you were eating and what you were extracting and absorbing from your food. I feel like for many people, there's a real tendency to be feeling so fatigued that they just rush to a store and like pick up all the energy support that is on the shelf without necessarily looking at the basics. Um, so if we're seeing something like that out of whack on blood work, what's the next step? Roughly, generally speaking.
Yeah, so if we see something out of the optimal range, we're wanting to work with that, and usually would use supplementation for a period of time, then retesting, seeing how any of our symptoms have changed, and doing all the other lifestyle things as well as we were talking about, making sure that we're not just reaching for excessive amounts of coffee to get back that energy, and really checking in to see that there's not something deeper going on that needs our support with either supplements or medication.
So you mentioned coffee. I know that's a big one with fatigue. Tell us a little bit about how coffee is going to be working for us in terms of energy, because it can work,
Hmm.
but there's also a bit of a downside too.
Yeah, so it depends on where you're at. Like using coffee as some people can actually tolerate it. Me personally, I can't tolerate it. I did more of the genetic testing and figured out that I don't break it down properly, which kind of makes sense, is that I get very, very amped up with it. So I'm super sensitive to having coffee, versus others can drink a ton and feel nothing. But if we're constantly kind of feeding in that external energy, then we're actually just going to be burning up our resources of like our adrenals are going to be damaged even more.
Can we chat a little bit about the adrenals, Jen?
Yeah, so I mean, our adrenals are where we're producing our cortisol. And when we're stressed, our cortisol is just going to go up. Eventually, when our body is it'll get to the point where it's exhausted and it's not effectively mounting that response to stress. So our adrenals also will help to give us that energy and manage our stress. So that's pretty much what they do.
Right, like the battery in a car. Like we
Yeah.
need to be charging it by driving. We need to be charging it by putting in good food and by resting and by checking in with ourselves. But we can't just be driving, 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 or never driving. We need to be monitoring that output a little bit. You mentioned cortisol. Cortisol being our major stress hormone. Is that something that we always want to be decreasing? Is it always a bad thing?
No, not necessarily. It's we want to be looking at when it's going high during the day. We need it to be higher in the first half of the day. That's what keeps us, gets us up out of bed, gets us that motivation to start our day. The problem that we usually see in practice is it's high at night and then it's low in the morning. So that's going to make people feel sluggish, not wanting to get out of bed, and then that wired and tired feeling at nighttime where they cannot get to sleep. So it's just a matter of kind of shifting that, lowering it down in the evening, and then making sure that we're having that morning energy.
So you are mentioning some testing around this. I know there's a number of tests that we have access to that people might be interested.
Mm-hmm.
Can you talk a little bit about some of those testing options? This is next level, once we've checked iron and B12 and thyroid function and you're eating fiber and all of those things.
Yeah, so we can do like a saliva test to measure our cortisol output, or we can also do just the Dutch test, which we both use, which is the urine test as well. So that can show us how our body is utilizing cortisol. Is it staying in its active form? Is it getting switched to cortisone, which is inactive? Like what's going on with our body and when we're getting that spike of cortisol throughout the day. So kind of gives us a better idea of what we're working with.
Right, a cortisol curve.
Yeah.
Because I don't know about you, but there's been many times when I have somebody in front of me that seems to be doing all the right things, and it seems like this is so clearly what's going on, but then we do testing, and
Yeah.
the results are totally different than we would have expected.
Hmm.
Can we talk a little bit about this concept of adrenal fatigue, whether that's a real thing or not, or what the phenomenon is?
Yeah, so adrenal fatigue is, it's not that your adrenals are actually fatigued, is that your body is not responding to the output from your brain as effectively as it prior was. So it's not that all of a sudden our adrenals aren't working, it's just there's a little bit of disconnect between our HPA axis.
And HPA axis being
The hypopituitary adrenal axis.
right. So how like the command center in our brain talks to the second down, then talks to our adrenal glands that tell us how much energy to drive. And what many people may not know is there's actually an HPO axis. So how the hypothalamus and pituitary then talk to our ovaries. And if that connection between our brain and our adrenals is kind of wonky, it's not unreasonable to think that the communication between our brain and our ovaries will be wonky, affecting ovulation. So that can really throw off menstrual cycles and
Hmm.
fertility. And when our hormones are off, it's going to be affecting our brain function again. And that can, of course, affect our thyroid.
Yeah, we're
So if
all one big system.
we are all a big system. So there's not like any one like adrenal protocol that we do for anyone that's tired, right?
Yeah.
So if this is great, Jen. I love this. I love how clearly you're laying this out. Um, Traditionally, when we think of adrenal fatigue, although we're really careful not to use that term in our office because it doesn't really mean anything, the phenomenon is real, but the name I prefer calling HPA axis dysfunction, that hypothalamus pituitary adrenal communication line being dysfunctional as opposed to your adrenals suck. What kind of symptoms, what might somebody be experiencing if they're feeling this HPA axis dysfunction slash adrenal fatigue, formerly known?
Yeah, so that's kind of what we had already spoken about, is it depends of where you're at in the stage. You can be in that you're still functioning well, but you're kind of like wired and tired. And then you can get to the point where you're in that exhaustion stage where you're just unmotivated, can't get out of bed, don't want to do anything. So um, it's important to know what stage we're at and then testing, obviously, to know how to approach it.
Does someone's age or body weight have anything to do with how they experience it, or does weight come into this at all?
I mean, it can definitely change as we get older, but yeah, it's variable from person to person.
Yeah, I mean, certainly we've seen people that when they're really stressed out, they seem to gain weight out of
Hmm.
nowhere and they haven't seemingly changed anything with the routine. And then I used to think this was lucky for some people that they'd be stressed and they lose weight until I'd seen it happen to a family member or two. And it can be downright spooky when you see someone like drop 20 pounds out of nowhere for because they are that stressed that their body's like, we're gonna burn all the resources right now because we've got nothing left.
Yeah, that's me. So that's how I usually handle stress, is to lose the weight. And then that affects everything with our hormones and our ovulation and everything else. So it's not a good thing to be that way.
So in this formerly known as adrenal fatigue state, um, if you were if you're seeing somebody that is really kind of in that tired and wired state, is that any better for someone than just being tired all the time? Is that a different treatment approach?
Um, I mean, it depends on the person and what their lifestyle is too. Like what else, what other factors are going in to that? Because yeah, it could just be that it's just a short period of time and that your body can recover from it, or it could be something more where it's like that's a thyroid thing going on, and that would make you feel more tired for a longer period of time. So getting in deeper and understanding what's going on is important.
Right. So not just assuming and reading something and saying like, this is what I'm going to do, but getting a good clinical evaluation, being really honest. I'm a big fan of cataloging our symptoms. And as you know, we have a number of questionnaires that we use to track, like, how is this specific metric? Are you losing hair? Is your sleep affected? Do you have any brain fog? Are you noticing vocal hoarseness? Have your periods changed? Have they got longer? Have they got shorter? Are they heavier? How is your weight? Is it changing? Are you losing it? Are you gaining it in a really weird place? Are there like extra hair growth? Like, is there anything, like just noticing everything so that as we get onto a good plan covering our basics
Yeah.
with proper testing, then we can say, yes, this, and this is better by this much. Because sometimes, I mean, the road to recovery is a little bit challenging if we've been dealing with a long-standing career or course of study or occupation that it just takes so much energy. So it can be really helpful then to have that from a clinical management perspective, that testing and that consistency. But what you're saying and what I want to get back to is that the habits that we have can really either work for us or be to our detriment, and our body's just always doing the best it can to keep us going as best as it can, no matter what we are throwing at it.
Yeah.
So, this is good. So you mentioned contrast showers. They suck to do, but you feel like $1,000,000 afterwards. Really increasing dietary fiber to stay fuller longer. And then you also mentioned getting adequate protein and fat. And then some meditation apps. Can you talk a little bit more about good sources of protein and fat in your diet amongst the fiber?
Yeah, so there's like so many different sources of protein, but making sure you're having more of complete proteins. So that's usually more animal sources, but you can definitely get them from plants with combinations. And then with the fats, you just want to be having like avocado, olives, like all those coconuts, like those are healthy fats that our body is gonna utilize, and it's not always a bad thing to be having fat. Never.
Right. That's like the first thing that we tell anybody with irregular periods, like, you need fat.
Yeah, because you need that cholesterol to make your hormones. So all the old ways of fat makes us fat. No.
Okay, that's excellent. Is there anything else that you would add if someone's just really feeling like in a temporary slump right now, energy wise?
Yeah, I mean, just we talked about like not drinking excessive amounts of caffeine, but like making sure you're hydrated too. Um, it's so easy to like go about the day and you're like, how much water did you drink today? And everyone goes about their day and forgets. So yeah.
Chugging water, like, do you want to like get it all down like twice a day and you're good like a horse, or like do you sip small amounts? Do
Sip
you
small amounts. We don't want to overwhelm our kidneys. So that's usually what will happen when people say, okay, I'm going to drink a ton of water today, and then they overdo it, which will make you just go to the washroom a ton because that's overwhelming the kidneys. So just taking little bits and slowly working yourself up, and your body will be able to tolerate to that new amount of water.
So if you're new to drinking water, you're not destined to pee constantly.
Yeah.
Once you get used to it. Okay, hydration. Do you add anything into your water? Do you recommend adding anything, or is like the plain tap water good? Like, what do you do?
Well, I use filter with mine, and then I will put either a little bit of Himalayan salt into it as an electrolyte, or I'll put an electrolyte powder. Just at least 1 glass of water a day is like that, and then throughout the rest of the time, just having filtered water is fine. Yeah, and then if you're obviously working out a ton, you want to make sure that you're replacing your electrolytes as well.
And like, with your experience with electrolytes, do they make a difference? Like, what do they do for you?
Yeah, if we're seeing back to that like adrenal aspect where people are really like in the burnout, it can help to support our adrenals by having a little bit of that sea salt back in, because we do need a little bit of sodium within our diet. It's just not the stuff that's from processed food. And that'll kind of help us feel a little bit more alert and energized.
Amazing. I noticed myself that in the early days of having my daughter, I mean, we're still early days, any day that I was not having either a greens powder or an electrolyte in my water, I
Mm-hmm.
would be so thirsty and I would start to get very headachy and just my brain was not working until literally my husband would have to say, "Did you have your stuff today?" No? Okay, well, stop complaining. Here's clearly your problem. You need
Yeah,
some electrolytes, and then it would always get better. And I feel
yeah,
like it's very easy to overlook something so simple as like, did you breathe? Did you drink your water? Did you put your stuff in? Did you take your supplements? And
yeah.
are you getting regular checkups? And are you getting regular answers to address the fatigue? Because you and I can both agree it's not a normal state of functioning. It's an adaptation to something that is not working, and your body's trying to make you be aware of it to figure
Mhm.
it the heck out.
Yeah, yeah, exactly.
So we talked about blood work. We talked about what you were doing. Um, we got a question. What are good electrolytes to add to water other than salt? I've got my ideas, but Dr. Jen, do you have any?
Um, I have a specific powder that I use from the Designs for Health. Sorry if we're not sponsored.
We're
um,
not sponsored. No one's getting paid.
yeah. I use that. And just being cautious that you're not getting an electrolyte powder that has an excessive amount of sugar or something added into it. Um, but in general, yeah, sea salt's just easy enough. Himalayan salt.
Sea salt is really, really, I find kind of idiot proof because most of us have it. I
Yeah.
have personally, when I was doing more extended fasting, which was, prior to getting pregnant, I would do a combination of sea salt and potassium citrate, which does not taste good. We used to see it marketed as something called no salt. But then we're getting a mix of sodium and potassium, which helps our kidneys function. You can also see, and we do this when we're camping, some electrolyte mixes from the World Health Organization website. They're often marketed for like helping children with diarrhea that might kill them. So it's usually a combination of like baking soda, sea salt, sometimes white sugar or honey is added for a little bit of energy. And often you'll see other people using coconut water as an electrolyte. I
Yeah.
like it a lot, but I don't love it first thing in the morning for people that do tend to feel really woozy and tend to have low blood pressure because it can drop it even further in the morning.
Mhm. Yeah, and it's a taste thing to get over if some people don't like the taste of it as well.
I mean, with most electrolytes, if there's any sodium bicarb, which is baking soda, it has like this really like alkaline, like smooth, rounded taste to it.
Yeah.
The other common one that a lot of people stock up on, is, especially with stocking up on all things, is Gatorade. Which,
Yeah.
what are your thoughts on Gatorade?
So that's what I am kind of talking about when we want to make sure we're not reaching for Gatorade, because we look at the sugar content in that and it's just outweighing the benefit of it. So much rather be having a powder that's not excessive amounts of sugar to
What
replace
about
those
if it's
ones.
sugar free?
Still has dyes in it, I believe, and I don't know. I'm a little leery about it.
Yeah, I'm not a fan of
Shouldn't.
Gatorade. First of all,
Yeah.
nothing in nature should be that brilliantly blue or
Yeah,
orange.
exactly.
And one of the concerns there is if you're using sucralose to sweeten something, it still jacks up your blood sugar as if you had had something sweet, but then your body's not getting that good payoff of actually something sweet. So you get it from both ends. And then I believe Gatorade also has bromide in it, which can interfere with thyroid function, which we have seen on some of our clients with if we do additional iodine testing for thyroid. Um, so I think that more than overkills that question. Does that
Yeah.
answer your question, Corey? This is excellent, Jen. Thank you so much for your time today. Do you have any other place that people can follow up with you and find you and see what you are up to, Jen?
Yeah, so I have my Instagram and my Facebook accounts that are just Jen Hardie. I'm like still thinking about that. And then, yeah, my website as well is Dr. Jen Hardie as well.
Jen with one N.
Yeah, one N.
Excellent. And you have a private practice in London, Ontario, and you've got some new exciting things coming in the works post COVID-19.
Yeah.
And I know you've been such an amazing gift, such an amazing addition to my practice over the last couple of weeks and months while I was off having a small human. And I know you kept just such a wonderful care of things in my absence. So it's my absolute joy and pleasure to have you and to see your face again and to share your knowledge, because you're super smart and you're always reading, and I always enjoy learning from you, Jen.
Thank you, Keila.
All right. Thank you for everybody that is joining us live today. It's so much fun to answer your questions and talk at you from our homes to yours. And we look forward to catching the rest of you on the replay. Stay tuned next month or next week. We've got another month of episodes planned every Wednesday. We are going to be tackling gardening. We're going to be talking chronic headaches that come about from sitting way too damn much, and talking with your teens. We've got lots in the works. So stay tuned. Happy Wednesday. Happy hanging out in your home. See you soon.
Bye, Keila.
Bye.